Most people think that Medicare is going to cover everything when they turn 65, but honestly, it doesn't even come close. I talk to people all the time who find this out too late. For example, when the bill shows up in the mail. Maybe it's a $3,000 hearing aid or a $12,000 emergency room visit overseas, or maybe it's just a denial for something they assumed would be covered. So today I'm going to walk you through 7 services that Medicare does not cover. The first one, and this one shocks a lot of people, is hearing aids. When you lose your hearing, you lose your ability to interact with the world, so it affects your health, it affects your well-being, and about 1 in 3 adults over 65 are going to experience some hearing loss. It starts out slow, asking people to repeat themselves, missing part of a conversation, but it doesn't stop there. Hearing loss can increase your risk for cognitive decline, depression, and believe it or not, even heart problems are linked to hearing. In fact, untreated hearing loss is linked to a higher risk of dementia. Medicare does not help with hearing aids at all. A custom-fit pair of hearing aids can cost anywhere from $2,000 to $7,000 and even more. So here's what Medicare does cover. 1 diagnostic hearing exam and a balance exam, but only if your doctor orders them to check on another condition. Second, it also covers 1 visit to an audiologist per year and only for hearing loss that comes on slowly, for long-term hearing loss, and diagnostic services tied to surgical implants. And that's it. Again, no coverage for hearing aids at all. Very, very sporadic, shoddy coverage for anything to do with your ears. So what can you do? Well, you have got 3 options. Number 1, get a dental, vision, and hearing combo plan. These are private insurance plans that bundle dental, vision, and hearing together. Typically, you get an allowance. For example, let's say $3,000 or $2,000 that you can use towards hearing aids. Now, this is great if you have a Medicare supplement plan and if you want to have some coverage for those areas. The second option is to join a Medicare Advantage plan that has a hearing benefit. Many Medicare Advantage plans include hearing aid benefits. The specific benefit depends on the plan that you choose, but they can range from maybe $1,000 to maybe $3,000 towards hearing aids. Sometimes they include a hearing aid for a copay. There's lots of different ways that Medicare Advantage plans can cover hearing aids, but here's the trade-off. You have to leave original Medicare and go for a private insurance plan that covers you for your Medicare. That means that you have to have a network of providers, you have different rules, and in some cases you have less flexibility than being on original Medicare with a Medicare supplement. So before switching, make sure that the plan actually fits all of your needs and not just covers hearing aids. If you're trying to decide between a Medicare supplement plan and a Medicare Advantage plan, we walk through all the pros and cons in another video, and I'll leave the link to that below. Okay, your third option is buy an over-the-counter hearing aid. In 2022, the FDA approved a new class of hearing aids that you can buy without a prescription. The over-the-counter hearing aid can work for a lot of people. They can work for mild to even maybe moderate hearing loss, and they typically cost somewhere between $200 to $1,000. And this is a great option if you're just starting to notice hearing issues and you're budget conscious and you don't want to deal with insurance and you don't want to spend the big money for the expensive hearing aids and you want something to get you through while you're figuring out the long-term plan. But if your hearing loss is more advanced, you're probably still going to need the custom-fitted devices, and that's going to take you back to options 1 or 2. Bottom line, don't ignore hearing loss just because Medicare ignores it. Okay, the next thing Medicare doesn't cover, routine eye care. Now, Medicare does cover some eye care services. If you have diabetes or you have glaucoma risk, they'll pay for exams. If you have an eye disease, they'll cover surgery, including like cataract surgery. But if you want to have a routine eye exam and to check your vision or catch problems early, no, there's no coverage for that. That might not sound like a big deal until you hear this. Many eye diseases have no early symptoms or early warning. They develop painlessly, and you may not even notice changes to your vision until the condition is quite advanced. That includes things like glaucoma, macular degeneration, diabetic retinopathy. All of these things can cause permanent vision loss, but they're treatable if they're caught early, and Medicare only pays once you have symptoms. They're not going to pay for prevention or to discover these things before they happen. And by the time you discover them, it may be too late. It may be too late to stop the damage. You may already be on a track where you've lost some of your vision or may lose all of your vision. To make things worse, Medicare doesn't cover glasses unless you just had cataract surgery. And even then, they'll only pay for 1 pair for your entire life. So what can you do? Well, you can join a Medicare Advantage plan. Once again, many MA plans have benefits for eye exams and glasses, and the specific benefit depends on the plan that you get and what's available in your area. But most of the time, these plans have in-network optometrists that you can visit, either at no cost or for a small copay. The second thing you could do is enroll in a dental, vision, and hearing combo plan. You could join one of these plans that I talked about earlier and get maybe $1,000, $2,000, or $3,000 of an allowance towards vision that can also be used towards dental and hearing. These plans are pretty flexible and they come in a lot of different varieties and they don't change your Medicare. The third thing that you can do is get a standalone vision plan. There are several companies that are offering eye care and eyeglass insurance like iMed and VSP, and they don't usually cost very much. They're actually quite affordable, and you can use them just for vision if you don't want to have the dental and hearing coverage. However, be sure that you compare the cost of the plan's premium versus how much it costs to use the plan to get eyeglasses and eyewear, because sometimes it's not worth it unless you're going to use the plan every year. So if you're going to use the plan every year, you're going to get your vision exam, you're going to get eyeglasses or contacts or something like that, then it's going to be worth it. Otherwise, if you're not going to use it regularly, then you might just be better off paying cash, which of course is the last option, which is you can just pay cash for these things, but ultimately don't forego your eye exam because Medicare doesn't cover it. It's too risky, so do something to make sure that you have your annual eye exam and that you're taking care of your sight. The next shocking thing that is not covered by Medicare is health care outside of the country. If you're someone who likes to travel and you're thinking about retiring or traveling abroad or going abroad, or maybe even some people retire abroad, original Medicare does not cover you outside of the United States. So if you get injured on a visit to Europe, or you catch pneumonia when you're on a cruise, right? Or you just happen to have gone across the border down to Mexico, or even just up to Canada, and something happens to you, you'll be stuck with the full bill if you're on Medicare. You're responsible for everything that happens outside the United States. Now, depending on where you're traveling, your overseas medical bills can be very expensive or could be not expensive at all. It just depends, but you will have no help from Medicare. So what can you do? Well, the first thing is Medicare supplement plans. Many of them cover some foreign travel. So some of them, like Plan G or Plan N, provide you with some coverage when traveling overseas. It only applies for medical emergencies, and the plan pays 80% and you still pay 20%. Most of them have a lifetime cap of $50,000. Once you reach $50,000, then you're not covered by the plan anymore. This only works for the first 60 days of a trip, so it's not good for someone who is living overseas. So if you have a short trip, it's a good idea. If you're traveling longer or you're planning on living abroad, then that window is closing fast on you. The second thing that you can do is join a Medicare Advantage plan. Medicare Advantage plans, many of them, not all of them, have coverage for overseas travel. And unlike a Medicare supplement plan, this coverage is typically not limited to the first 60 days. It applies as long as you have the plan. And also, unlike a Medicare supplement plan, the coverage typically does not have a lifetime cap. It's not capped usually at $50,000. Most of them are uncapped. They'll cover you when you're overseas. Now, overall, Medicare Advantage is slightly better for international travelers than Medicare supplements. However, both fall short if you're doing long-term traveling or you're living outside of the United States or outside of its territories, and that's why I'd encourage you to either look into travel insurance or health insurance options in the country that you're living in if you're actually an expatriate. Okay, number 4, and this is a big one, and maybe the most misunderstood of all of my points today, Medicare does not cover long-term care. We all want to be strong and independent forever, but the truth is that 10, 20, or 30 years from now, you're probably going to need some help. And that's why it's a good idea to plan for that now rather than when it happens in the future. Because Medicare does not cover things like long-term stays in a nursing home, or a personal care assistant, or home-delivered meals, or home and community-based services. Essentially things that would be considered custodial care. So if you need help with the activities of daily living, or ADLs, things like dressing, bathing, eating, if you need help with those things, Medicare doesn't cover that. Instead, Medicare only covers skilled nursing facilities. If you've been hospitalized for 3 days, you can go into skilled nursing facility for up to 100 days. But if you go past 100 days, then Medicare won't cover you any longer. And during those 100 days, you have to be there for rehab. You have to be there because you're being rehabilitated. If you're going to permanently be there, Medicare will stop covering immediately. So it's really for recovery, not for long-term care, not for custodial care, not for memory care, none of those things, just for acute care. A good example would be someone who fell and broke their hip. It's a common scenario that we see as you get older, as you're aging, your bones become more brittle. A fall can be very dangerous. So someone falls and breaks their hip. That is an acute condition. They go into the emergency room. Then they're admitted to the hospital. They spend multiple days in the hospital. Maybe they have hip surgery, right? That's what happened to my dad. And then they go into a rehab. In the rehab, they're there for a month or maybe a little longer. During that time, Medicare's covering them because they're recovering from a fall. But when it goes past that, in the example, unfortunately, of my father, after my dad's surgery, he was just not in a condition where he could return home. And so it was going to transition from skilled nursing to long-term care. Medicare will no longer cover that once the determination is made that this is now a permanent situation where this person is going to need help with the activities of daily living. So what are your options? Well, one, you can get long-term care insurance. Long-term care insurance only makes sense if you buy it in advance. You can't get long-term care insurance when you need long-term care. Think of it like life insurance. You can't buy life insurance after you've died, right? You have to think in advance. Same with long-term care insurance. The younger you are, the more affordable it is. The older you are, the more expensive it is. And if you're unhealthy, it's prohibitively expensive. But that's the first option. The second option is Medicaid. Medicaid is a joint federal and state program that's offered through your state. Sometimes it's called different things, like in California, it's Medi-Cal. In other states, it's Medicaid, but Medicaid covers you when you don't have enough money and your assets are too low. So Medicaid is like welfare. You have to spend everything you own first, all the way down to $2,000 and your house and your car. One house, one car. When you have one house, one car and $2,000 left to your name, then Medicaid will begin to cover you. And the quality of your state's Medicaid program can vary. You could be covered for long-term care, but you don't get to choose things like which facility do I go to. You have to go to a long-term care facility that accepts Medicaid. The third option is to have a loved one take care of you. Just this year, Medicare started covering caregiver training. If a nursing or long-term care facility, nursing home, long-term care facility is not for you, but one of your loved ones is willing to give you all the proper care, they can go through training and that training can be covered by Medicare. Now, it's not covering your actual care. It's not covering the cost of that are incurred in that person caring for you. It only will cover the training on how to administer medications, how to provide personalized care, how to take care of someone as the caregiver. So it's caregiver training. Now note that Medicare only covers this if your doctor or your healthcare professional says that the caregiver training is appropriate for your treatment plan, and your caregiver also has to be available to have training sessions without you being present. Okay, here's another surprising thing that Medicare doesn't cover. Routine dental care. No cleanings, no fillings, no crowns, no root canals, no dentures, no posts, none of it. Look, I am not a doctor, but I don't need a professional to tell me how critical your teeth are to your health care. In fact, the Mayo Clinic even says that bad oral health may cause things like endocarditis, cardiovascular disease, and even pneumonia. Despite this, Medicare does not even cover routine dental services. Instead, Medicare only covers dental if it's tied directly to a covered medical treatment. So think of it like this. Let's say you were in a severe car accident, knock on wood, and your face was smashed and they had to reconstruct your jaw. Okay, Medicare's going to cover that, but they're not going to cover regular treatment for your tooth decaying or for the painful toothache or any of those things. Now, this doesn't make a lot of sense to me because you need your teeth to live, you need your teeth to eat, but this is kind of how things have developed over a long period of time where health insurance didn't include dental, vision, hearing. Those were like separate. Don't ask me why, because it seems to me like your mouth is part of your body and your ears are part of your body and your eyes are part of your body, right? Doesn't make sense to me. But you need to get things like cleanings. You need to take care of your teeth. You need to have fillings looked at, especially as you get older. You know, I have fillings that I got when I was younger, and most of them have had to be replaced. Some of them have resulted in root canals over the last 40 years, right? So you've got to take care of your teeth. So one option to do that is to get dental insurance. There are standalone dental plans. They run from, say, $20, $25 to $50 to $75 a month, depending on how much of a limit you need. These plans will usually pay $1,500 to $1,000 in any given year towards your dental. So in the average year, this type of plan could cost you around $700 to give you a few $1,000s in coverage. So you can opt for one of these dental plans, or you could take a dental, vision, and hearing plan that I talked about earlier. A lot of times we like those because you can use them multiple ways. It just depends, and it also depends on what's available in your area. The second option is to enroll in a Medicare Advantage plan that covers dental. Now here is an example of one of those plans to give you an idea of how they work. In this example, the Medicare Advantage plan gives you a fixed amount for dental services. This example is $1,000 and it resets every year. This is a common dental plan that we see often in Medicare Advantage plans. If you exceed the $1,000 in dental, then you have to pay the remaining of your costs out of pocket for the rest of the year. And if all you need is routine checkups and cleanings, then with most of these plans, they will cover everything for you and you don't have to spend anything out of pocket. But again, it varies very widely depending on where you live. Always remember that when you join a Medicare Advantage plan for something like dental benefits, you are leaving original Medicare. So you need to make sure and research how this affects your healthcare coverage before just jumping in to a Medicare Advantage plan. With that said, more than half of the people who have Medicare have joined a Medicare Advantage plan, so it works for a lot of people. Your third option is to just pay cash. We found that about half of the people decide to just pay cash for their dental services, for their simple dental procedures and checkups and cleanings. And the average cost for a cleaning is roughly $100 to $150. And most people get 2 cleanings a year, so that's $200 to maybe $300. As long as you're not doing all the add-ons, right? When you start to do X-rays and fluoride treatments and things like that, then the cost definitely goes up. Some dental clinics also have discount programs for returning clients who pay out of pocket and for seniors because many of them know that there isn't coverage on original Medicare for dental. But if something serious comes up, you could spend thousands of dollars just for one root canal, right? So it's a good idea to consider coverage for yourself, particularly for those scenarios. Okay, here's another surprising thing that Medicare doesn't cover. Medicare does not cover an annual routine physical exam. Yes, Medicare offers something called the annual wellness visit, but that's not the same as an annual physical exam. And if your doctor codes it wrong, Medicare won't pay for it. So here's the difference. A routine physical exam includes blood work and is not covered by Medicare. An annual wellness visit does not include blood work and is covered by Medicare. So blood work for Medicare is only covered to diagnose a condition. So for example, let's say you go in for your annual wellness visit, and while you're talking to the doctor says, something doesn't seem right about your blood pressure. We're going to run some tests. Now they're running tests to diagnose a condition, and Medicare will cover that. But if there's no specific purpose, and they're just running blood work to say, let's just check all your vitals and see what they are, Medicare will not cover that. So to avoid a surprise bill, when you go to your doctor for your annual wellness visit, make sure that they understand and that their billing department codes it as a Medicare annual wellness visit, not a routine physical. And your doctor's office should know how to bill that correctly. But if you go in for your annual wellness visit and you receive a bill in the mail, don't pay it. Contact the billing department and explain to them that they need to bill it as an annual wellness visit and not as a routine physical exam. So how do you get coverage for routine physicals? Well, one option is to join a Medicare Advantage plan. Medicare Advantage plans typically have a very robust annual wellness visit that includes some additional diagnostic things like blood work, etc. So that could be one option. Of course, the other option is just make sure that your doctor is billing it correctly, as I explained earlier. Okay, the final and the most shocking thing that Medicare, speaking of original traditional Medicare, does not cover is prescription drugs. It doesn't cover your blood pressure meds, your cholesterol pills, your basic antibiotics, none of those. And you need a separate plan for that. And here's the part that most people miss. If you sign up for a prescription drug plan or Part D plan, when you first get Medicare, you're fine. If you do it later or you wait, then you'll have a penalty. And it's not just once. It's every month for the rest of your life. You're going to have to pay more than everyone else forever because Medicare requires that everyone participate in Medicare Part D. Now, Medicare Part D is only offered through insurance companies. You cannot get prescription drug coverage from the government. You can only get it from insurance companies, and you're required to get it. Think of it like buying a car. When you buy a car, you're required to get insurance. The insurance doesn't come from the government, but the government requires that you insure. The same thing is true of a Medicare Part D or prescription drug plan. So here are the two most common ways to get coverage for prescriptions. You can get a standalone prescription drug plan that goes with your original Medicare, which is just prescription drug plan from an insurance company. Or you can go with a Medicare Advantage plan that includes all of your Medicare and your prescription drug coverage, which we've been talking a lot about in this episode. So a standalone prescription drug plan or a Medicare Advantage plan are the most common ways that people get coverage for prescriptions. But remember that some people have outside coverage. Maybe you have coverage through the VA because you're a veteran. Or maybe you have coverage through an employer-sponsored plan. As long as that coverage qualifies with Medicare as being creditable, which means it credits towards Medicare, then you don't have to get prescription drug coverage. But if you don't have other coverage, don't go without a Medicare Part D plan because you are going to get a penalty and it increases every month, 1% for every month that you delay your enrollment in a Part D plan. In 2025, the base premium is $36.78. A 24-month delay would be $8.82 extra a month. Now, that's over $100 a year that you're going to have to pay going forward forever. And what's worse is that the prescription drug penalty increases every year as the cost of Part D plans increase every year. So if the Part D premium goes up to $41, then now your penalty goes up to $9.84 per month. Imagine over 10 years, that's $1,200 in penalties. Now again, there is one exception to this rule. If you have creditable drug coverage from elsewhere, then you can delay your enrollment without penalties, but make sure you know what you're doing because the penalties with Medicare are lifetime penalties and they really can hurt you. So now you know 7 things Medicare doesn't cover and hopefully you're $1,000 smarter for it. But now the real question is, how do you actually get the coverage you need? If you're stuck and you're dancing between Medicare Advantage and Medicare supplements, then watch this next. I'll walk you through the pros and cons and how to avoid the mistakes that people make when they're picking their coverage. And if you're still not sure and you want to talk with someone who knows a lot about this stuff, click the link below to book a free call with us and we can walk you through your options. I'll see you there.